I'm a medical oncologist, and I have a focus in treating sarcoma. Sarcomas are tumors of connective tissue. Connective tissue is really anything ranging from muscle to fat, blood vessels. Those are all considered connective tissues. They account for about 1% of adult cancers and 20 to 25% of pediatric cancers. Because sarcomas are so rare, it is really important to seek treatment at a center that has specialists that have experience in sarcomas. Once a week, we have a team conference that we call Tumor Board. All the different specialists that have a focus in sarcoma get together and we present new cases. CT scan of the abdomen and pelvis. We all review cases and come up with a group consensus on the best treatment approach for each individual. My role is to manage chemotherapy and other drug therapies that go throughout the bloodstream and your whole system. Chemotherapy is only one aspect of sarcoma treatment. We use chemotherapy in different settings for sarcomas. If a tumor is difficult to remove by surgery, we can use chemotherapy up front to help shrink a tumor to make it more easily removable by surgery. We give chemotherapy after surgery to help reduce risk of recurrence. For patients with metastatic disease or advanced cancer that has spread to other organs, chemotherapy is a vital part because this is treatment that goes via the bloodstream and can help control cancer really anywhere in the body. So a lot of chemotherapy nowadays is given on an outpatient basis in the infusion center, so patients come get their chemotherapy and go home. For sarcomas, we do use continuous infusions of chemotherapy that have to be given in the hospital. Usually over 4 or 5 days, there's just a closer level of monitoring because it's a continuous infusion. Chemotherapy does obviously have side effects. Nausea, we are usually good at controlling with nausea medicine.
I had like a chemo class to go over everything that would happen to your body, from like switching to a softer toothbrush to your hair falling out and you know, your appetite and everything in between.
Certain drugs do cause hair loss, and that is something that can happen within a couple weeks of starting chemotherapy. So I always counsel patients on that just to be prepared for that. We have fertility clinics that work specifically with cancer patients. Certain side effects like nausea may go away really quickly. Hair growth might start back maybe within a couple months after finishing. Overall, I would say within a few months, patients start to feel sort of like their normal selves again. So I think it's very important for patients to engage their medical team and to always feel comfortable approaching their team with questions. No question is too simple to ask, in my opinion.
And I think Dr. Budati is very good at telling me, like, these are the things we know, these are the things we will know. And I don't know how he does this, but he's also able to move me out of some of my panic into not panicking.
Other questions might be related to nutrition. We have dietitians help answer those questions. Of course, our social workers will help address issues related to social support, psychosocial support, caregiver help. My patients become a very big part of my life, and I become a big part of their life as well to help guide them throughout their treatment.
He's come to visit me personally when I've been inpatient for chemo. I just really enjoy looking up and seeing him and knowing that he took the time out of his day to personally check and make sure I'm in good shape, and he's got my back. I just really trust him with my care.